somebody told me once they heard about Hillary passing away that it's grief is love that has nowhere to go.
Yeah, it's a strange dichotomy of total emptiness and incredible gratitude that you ever had that time with them to begin with. Our daughter, Hillary, was a student at ASU, and when she passed away, a friend sent me Dr. Joe's book. So we had to come and visit, and we fell in love with the place.
Yeah, I mean, it is emotionally draining work. And I cry a lot, and I cry pretty easily. I do the work because she's dead, and I have to bring her presence to the world somehow. Today's her birthday, so sorry. You know, I love these people here who come here, and I love their children and their partners and their parents and their siblings, and they trust us with something that's so sacred and so holy that it feels like a tragic privilege to do the work. And even though it's hard work and emotionally draining work, I couldn't imagine doing anything else. So my area of research is traumatic grief, all aspects of traumatic grief really, including social support, ritual, different population responses, intervention research. And it started because I lost a daughter in 1994, actually 27 years ago. And her death sort of catapulted me into this area of research and practice as well. So that became my calling, and that's how I came to research traumatic grief in various populations. We know that restorative spaces can be really therapeutic for people. There's plenty of research, there's plenty of data out there on the effects of nature on our physical health and our emotional health. But there was nothing on the effects of nature and natural environment, and particularly animals, on people who have experienced traumatic grief. A PLOS study that I recently did with colleagues, we actually asked about social support in grief. And we included all kinds of human categories. The question was, who are the actors and what are the actions of good grief support? And we asked about various human groups. We asked about, nursing staff, physicians, people at the hospital, social workers, mental health providers, friends, family, neighbors, colleagues, workmates. We asked about many various human groups. And then we also asked about pets and animals and how they were supportive for people in grief. And we were really surprised to find that basically the pets and animals blew every other human group out of the water when it came to good grief support. And we sort of chiseled down in the data to find out why. And it seems a couple of reasons. Less frequently, it's the companionship and having someone to take care of. So people talked about how they were in such deep grief that it was hard to get out of bed, but they knew their dog or their cat was reliant on them, and so they got up. It was someone to take care of. But more, what we saw was that they just had a presence about them. When people were weeping, crying, moaning, just emoting, animals came up and they would just sit with them and stay with them. They didn't leave. Whereas they felt a lot of human beings either tried to fix their grief or would leave. It would make them uncomfortable and they couldn't take it. They would check out. I have always loved animals and I've always had a big heart for animals. And I guess I knew for me, in my experience, my dogs were performed much better than nearly every human I met. But I didn't know it was that pervasive. And so that was a really interesting study. I was glad that we were able to get that published. I mean, I think one of the most important things that I've learned from my research and from practice, from working directly with people, is that we need each other. We need each other. We need support. We need the presence of others who can bear witness to whatever depth and breadth our pain happens to manifest in any moment, without trying to make us feel better, without trying to ameliorate that pain. So we just need a more compassionate society, and I think we could take a good lesson from animals.